We're about to take the first keynote speaker, and that will be Dr. Anne. But just before she does speak, I think it's important that you get to know a little about her. She's an associate professor in journalism and communication from Bournemouth University. Dr. Anne Luce is an associate professor in journalism and communication with nearly 10 years of investigative journalism in data journalism, covering health and science, business reporting, covering government and politics, and editorial writing experience in the United States. One of the most notable pieces of journalism was investigating suicide rates in Florida, which garnered support for the creation of the Office of Suicide Prevention and Drug Control in the state of Florida, and also won a Responsible and Ethical Reporting of Suicide Award from the then Governor Jeb Bush. She researches in the area of suicide and media and is author of Bridging Suicides, Suicide and Media, and editor of Ethical Reporting of Sensitive Topics and Midwifery, Childbirth, and Media. Ladies and gentlemen, meet the keynote speaker, Dr. Anne Luce.
Good morning, everyone. Thank you so much for inviting me to be a part of this panel. I'm very happy to be here with you all on World Mental Health Day. I'm going to go ahead and share my screen now and hopefully speak for the next 20 minutes or so. So I come to the topic of suicide prevention with many different hats. As the introduction clearly said, I've worked in journalism, covering suicide and public health in the United States. I did that for 10 years. I have lived experience of suicide, having lost my partner to suicide in 2005. He incidentally killed himself in a public space. And at that time, the newspaper I was working at ended up covering the newspaper covered his death. I'm also a researcher in the area of suicide prevention with nearly 15 years experience. I'm the UK national representative to the International Association of Suicide Prevention, and I'm an elected member of the National Suicide Prevention Alliance here in the UK. Since 2007, I've actually sat on the World Media Task Force for the Prevention of Suicide. And within that role, I've helped write media reporting guidelines for the World Health Organization, blogging guidelines for SAVE, which is the United States, the largest mental health charity in the United States. And I've also contributed to #ChatSafe, which are guidelines that have come out of Australia and have been adopted by Facebook to help young people talk about suicide safely in an online environment. So I thought what I would do is just to provide some global statistics so that we all are coming at this from a similar place. So there's over 800,000 suicides a year. We do think this number is actually quite conservative and that it's probably 3 times higher. We know that suicide claims more lives than war, murder, and natural disasters combined. We know that suicide accounts for 1.4% of deaths worldwide, making it the 17th leading cause of death back in 2015. We know that for every 1 individual that dies by suicide, 20 more will attempt. And we know that every 40 seconds, a person dies by suicide. Yet we know that this is also going to increase to 20 seconds by the end of this year. When it comes to Africa, you're probably more aware of these suicide rates. Lesotho has the highest rates per 100,000 people and ranks 2nd in the world for the highest suicide rates. Nigeria has the 7th highest suicide rate in Africa and ranks 15th in the world. And this has all come from the 2016 World Health Organization stats. So, now that we have kind of a bit of information about the statistics, I just wanted to provide a framework on suicide from which we can understand the media reporting of suicide. So French sociologist Émile Durkheim's work on suicide established the sociological framework and theory that's still used today by many suicidologists. And he argued that suicide is the result of society's strength or weakness of control over an individual. So within his theory, theory, Durkheim identified 4 categories that each completed suicide would fit into based on the individual's relationship to society: egoistic, altruistic, anomic, and fatalistic. Now, according to Durkheim, egoistic suicides are people who are not connected with or dependent on their community. So in the media, this is the type of story we see about someone who is detached from their local community or their society as a result of mental illness. In contrast, the person who is overly integrated into a group and feels that no sacrifice is too great for the good of the larger group, that would be considered an altruistic suicide. So these tend to be media stories that we would see, for instance, about suicide bombers. Anomic suicides occur when the person who's died is not capable of dealing with a crisis in some way, or their relationship to society has suddenly changed. So what we see is that suicide is framed as a solution to a problem in this particular form. So in the media, these are the types of stories you'll see about a banker who has died by suicide as a result of losing a great deal of money, or it could be the breakdown of a relationship or a marriage, for instance. The last category is the fatalistic suicide, and this is thought to be caused by excessive societal regulation that ends up restricting a person's freedom. So this person does not see any viable future for themselves. So we may see these stories coming out of countries such as Belarus or North Korea, where the form of government is dictatorship and the rates of suicide are extremely high. Now, Durkheim's work was a starting point, and while the categories still hold true today, it's the details that still need to be understood. So, for example, the differences between genders or the choice of method. But what you need to understand, and the video in the beginning really alluded to this, is that suicide is a complex issue. It's never as simple as one reason for the death. It's complex, it's complicated, which makes suicide prevention quite complex and complicated, because what works for one person may not necessarily work for the next. I just want to briefly touch on method, as it's important to understand that when we talk about media, because method is something that journalists tend to get wrong quite a lot. Now, the most common forms of method around the world are poisoning, hanging, suffocation, drowning, firearms, jumping, and overdoses. Historically, we'd seen a difference between the genders when it came to choice of methods, with more violent means like hanging and shootings being linked to men, and more softer means linked to women. So, example, overdoses or carbon monoxide poisoning. But this we're actually starting to see has been changing over the last 10 to 12 years. And those categories of soft and hard means perhaps don't hold as much as they have in the past. So just a few words on stigma before we really address it in media reporting. So suicide is stigmatized in countries around the world, and we have a long way to go before we can destigmatize the issue and really address it as the public health issue that it actually is. Now, if there's one thing that you take away from today, I would ask if you could please stop using the phrase commit suicide, and instead think about using the phrase died by suicide. Now, the reason for this is because the phrase committed suicide or commit suicide is steeped in criminological framing. So I often say that suicide is the end stage of a mental illness. But we don't hear people say, oh, you've committed cancer, or oh, you've committed a heart attack. So when we talk about suicide, it isn't a crime in many countries around the world. So we want to treat the phraseology, but we also want to treat the actual act of suicide as a public health issue. And the greatest thing we can all do is to start using that phrase died by suicide rather than commit suicide. Now, where did the stigma around suicide come from? Well, the evolution of suicide has had stark changes over time. In antiquity, it was a proper way to end one's life nobly. while during the Middle Ages, it was a mortal sin because of the evolution of religion and the Christian faith. It then became a psychotic act, or today, in some circles, it's actually considered a rational act or even a human right. Now, when Durkheim and Freud began studying and discussing suicide, it was determined that the suicidal act needed to be seen in relation to the individual and their societal circumstances rather than an act against humanity. Now, unfortunately, because of the stigma in many countries around the world, suicide is still seen as an act against God or an act against humanity. So when it comes to stigma, we need to be careful about the language that we use. We need to avoid terms such as the mentally ill, a victim, the afflicted, a person suffering from, a sufferer. Instead, we need to say that a person with mental health problems. So we use person-centered language, a person living with bipolar disorder, not a bipolar person. We also need to be aware of how we stigmatize. So for instance, a man in his 40s who has a heart attack has sympathy. We rally around him in our local communities. We try to help him get better. However, a man in his 40s who has depression is most times considered weak, unbalanced. He needs to man up and get over it. So the way that we think about physical health compared to mental health, we really all can take better responsibility for the language that we're using. Now, when we talk about language, and especially when it relates to suicide, you need to be considering, are you using the appropriate language? So can you actually cause harm? Can you hurt vulnerable people? And when I talk about vulnerable people, I'm talking about those who've been bereaved by suicide, but also those who are at risk of suicide as well. Now, stigmatizing language consists of labeling. So this would be when we would say someone is a bipolar person instead of a person with bipolar disorder. Stereotyping is when you call someone crazy or unhinged or a psycho. And separating is that we're the normal people and anyone with a mental health problem is abnormal. Now, the reason why this is also important is because of the media. We know from the research that media reporting of suicide can increase copycat suicides, but we also know that responsible and ethical reporting of suicide can help prevent suicide from actually happening. So the World Health Organization and the World Media Task Force within the International Association of Suicide Prevention have created two sets of guidelines for journalists on the reporting of suicide, one in 2008 and more recently in 2017. Now, these are global guidelines that can be used by any journalist in the world to help better their reporting of suicide. In most low and middle income countries, the WHO guidelines remain the main referencing document that guides media practitioners in reporting suicide. But just like high income countries, journalists and media outlets in low to middle income countries are not using them. Now, the global research that's been carried out tells us that many journalists don't know that they exist, or they're just too busy to use them. Now, I have a solution for that, which I'm going to come to in a few minutes. So what do the actual World Health Organization guidelines say? Well, they're quite in-depth, but there is a lot in there that journalists need to digest and a lot that they have to manage. But you have to remember that journalists are not trained in suicide prevention. Journalists are taught to cover suicide stories like a crime story. For most journalists, covering a suicide is no different to covering a murder or a home invasion. And we're back to that crime narrative again, which is really difficult to break. And we have to work really hard to move away from the crime narrative into a public health narrative, especially if the stigma and criminological undertones are still there within a country or a particular region. So what did the guidelines say? Well, here's the first half. They say provide accurate information about where to seek help. That is the first thing on the list. It says educate the public about the facts of suicide and suicide prevention without spreading myths. Report stories of how to cope with life stressors or suicidal thoughts and how to get help. Apply particular caution when reporting celebrity suicides. Apply caution when interviewing bereaved family or friends. Recognize that media professionals themselves may be affected by stories about suicide. But there are 6 more guidelines that are actually really important. And I would say, or arguably, these are even, more important than the previous 6. But the problem is we know globally these are not being followed. So the 7th one, do not place stories about suicide prominently and do not unduly repeat such stories. Do not use language which sensationalizes or normalizes suicide or presents it as a constructive solution to problems. Do not explicitly describe the method used. Do not provide details about the site or location of the suicide. Do not use sensational headlines. Do not use photographs, video footage, or social media links. Now, when it comes to the research about media reporting of suicide coming out of Africa, unfortunately, there is very little. The research that has been published and has mostly been completed actually by the authors listed on the slide there. Those colleagues are based in Ghana. In their most recent piece of research, which was published in May of this year, they tested whether the WHO guidelines were being used by journalists in Ghana, and overwhelmingly they found the answer to be no. So they analyzed 288 news reports, of which about 91% were completed suicides. About 2.5% were attempted suicides, and about 7% were homicide suicides. So what they ended up finding was that 92.7% mentioned the specific method, which they shouldn't have done. 82.6% included suicide in the headline because, you're not supposed to do that because it's sensationalizing the act of suicide. 55.6% included photos of those who had died, and in some instances the family did not know about those photos and saw them in the either online or in the newspaper for the first time. 82.6% included I've already got that, sorry, that's in there twice. This is the big one. In 80% of headlines, the phrase committed suicide was included in the headline. And this is really problematic and something that we need to change. And 92.7% of the news reports mentioned the specific place or location where the suicide took place. Now, the reason why the guidelines say that we don't want to talk about the specific place or location is because we don't want it to become a place of interest where other people who are vulnerable to suicide think, oh, I can go and kill myself there too. So it's really important in terms of what journalists are writing to really be following the media reporting guidelines. It's the same with the method. We have a lot of research globally that says that if journalists report a specific method and then details, like almost a roadmap of how to, use that method to a place where you could kill yourself, we have the research that says that can lead to copycat suicide. So we have to be very careful. Now, none of the stories that the authors listed here out of this piece of research, none of the stories supplied helpline information for a support service. And we know that is the number one thing that journalists can do to actually help prevent suicide. None of the stories tried to educate the audience about the facts of suicide. So they relied on myths of suicide, which can be really harmful and detrimental. And none of the stories mentioned a suicide prevention in the country. So there are several suicide prevention organizations within Ghana, and not one of them was mentioned. So in some ways, that's really shoddy reporting, and that's my personal opinion. But the whole challenge here is, how do we get journalists to actually use these guidelines? Now, My colleague, Dr. Sally-Ann Duncan, and she's at the University of Strathclyde up in Glasgow in Scotland, here in the UK, she and I have created the responsible suicide reporting model, which we use with journalists and journalism students around the world. And what we've done is this model helps them adhere to the media reporting guidelines, such as those provided by the World Health Organization, or here in the UK, we have the Samaritans. In Australia, they have Mindframe. But what we've ultimately done is we've grounded this model in the professional practice of storytelling, and we ask journalists to apply a standard of moderation to their stories, so that their stories are following the guidelines, but the journalists and the newspapers and the media houses are not feeling like they're being censored, which is one of the biggest complaints that we get. So applying a standard of moderation to their stories enables journalists to produce content that is more responsible. So the standard of moderation avoids sensationalistic and harmful reporting. So there's 6 questions, and we do quite a bit of training around this with journalists, but we get them to this point where they're able to apply this standard of moderation. And what they have to do is they have to ask themselves these 6 questions when they're reporting. If they do ask these questions, we know that they will minimize harm to those who've been affected by their coverage of suicide. We know that they tell the truth, but they don't use it as an excuse to use explicit details that could encourage others to take their own life. There's an accountability in that the journalists avoid using stereotypes, harmful content, and stigmatizing narratives. Using our standard of moderation, they get to check in with themselves and ask, is my reporting of this suicide moderate in content, tone, and language? We also ask them to think about their use of social media, which we feel, based on our research, is seriously lacking. So media reporting guidelines are outdated and urgently need to focus more on this, on online and digital tools. We also have reminded journalists through the standard of moderation that they need to provide those helpful information boxes alongside their stories, which again, we know from the research, this has a positive impact on supporting vulnerable people. But even with our responsible suicide reporting model, we know that journalists will still struggle to follow the World Health Organization guidelines. So we created this video, which I've asked the organizers of this event, they're more than happy to share my slides with you, but we've created a video that you could give to journalists to ask them to watch, and that would help them. But actually what we did is we created the suicide reporting toolkit. And I'm just going to show this to you really quickly. So this is the suicide reporting toolkit, and it is for journalists and for educators. And the website is suicidereportingtoolkit.com. The toolkit is free. It's accessible. It's a resource that journalists can use to make sure they're reporting ethically and responsibly. We've had great feedback from the toolkit, with hundreds of people getting in touch to say how it has helped them. I would love if you can share this resource with journalists you work with across Nigeria, across Africa, wherever you're dialing in from, to be perfectly honest. But ultimately, this, we have some videos on here that kind of explain what's going on, but journalists just click on this particular link and it will take them to the whole page that they need to know. So this is the video that I've provided in my slides, but this ultimately walks them through what kind of story are they writing, how do they apply the ethical rules, now apply the standard of moderation, and it walks them through the whole process of covering a suicide story and what actually needs to be in their story. So we talk about how do they write headlines, what language do they use, what should they write in terms of the method, what do they do in terms of location, the placement of the story, how do they engage with social media, how do they add video or audio or podcasting content? How do they make it work for the web in terms of SEO, search engine optimization? What should they do around photos, videos, and slideshows, infographics? How do you cover a celebrity suicide? And then reinforces that they should, if in any doubt, go to the guidelines and the codes. There's loads of information on this website. If you're teaching journalism or you're working, teaching journalism students, there's an educator's toolkit, which has lesson plans further down the page for academics in terms of how to create a safe space in the classroom. What do you do? What's the approach? This can also be, adapted to anyone who is running trainings within a charity organization. If you wanted some best practice, there's a section on self-care for journalists. In the sense that, how do you look after yourself before you cover the story, when you're covering the story, after the story. And there's a whole host of resources on here gathered from around the world that journalists can lean on, to support what they're trying to do. To finish up, we need to start the conversation with journalists in Africa about how they can better ethically report on suicide. We also need to build capacity around media reporting of suicide research in Africa. But journalists have a responsibility to report ethically and responsibly. No other story that a journalist writes can actually cause more harm. They have to get it right, and lives depend on them getting it right. So thank you very much for listening, and I'll stop sharing my screen, and I'm happy to answer any questions.
All right. Thank you very much, Dr. Anne. That was quite an eye-opener, and it's been exhilarating to hear you speak about this. It's been very, very educative and informative. Quickly, here's a question.
Sure.
Speaking about stigma and stereotyping.
Sure.
Should there be some form of sanction or punishment for people or journalists who engage in this so as to cushion the effects? I mean, reduce it to the barest minimum, just so a lot of journalists do not report while stereotyping or trying to demean an individual and causes him to resort to suicide. Should there be some form of sanction or punishment so as to stop it?
Well, I think, to be honest with you, where we've seen punishment with journalists doesn't really work. And we have evidence from around the world that just is not a good way to go. What we need to do is we need to build relationships with journalists. Now, where this has worked amazingly well is in Australia. So Australia has an organization that's backed by the government, that's backed by public health, that is supported by, people across Australia. And ultimately what they do is they go into newsrooms and they educate journalists and they teach them the best ways to report on suicide. And what they do is when the journalists report well on suicide, they send them an email and say, hey, well done. Thank you for helping to save lives. And when they haven't done it well, what they do is they actually go back into that newsroom and do more educating and more teaching. And so that's what I do here in the UK and around the world, actually. I work with journalists in India and Malaysia, and elsewhere. And it's, and it is just about education, and it's a culture shift that has to happen. But punishment doesn't get us what we need. It's really about working together with journalists, educating journalists, teaching them about suicide, teaching them about how it's a public health issue. And when they understand that, and then their reporting starts to reflect that, that is when you can start seeing a larger societal change and shift. I hope that answers the question.
Yes, it does. Thank you very much, Dr. Anne.
Thank you.